So then when you're meeting with people turning 65, it's always good to just weigh out those options. Maybe they need to go on this plan for a few years, get things straightened out, and then go on something else. If they go on an Advantage and then down the road they want to supplement because they come out of the hospital and the doctor says you need something, well, you can't get it. It's like trying to get life insurance on your deathbed. I'm working past 65, so if people want to keep working, they can and not pull their Medicare at 65. So if they have coverage through employee coverage, and there's at least 20 employees at their work, they have credible coverage for not going on Medicare. So then if they're not taking their Social Security, they don't have to call Social Security and request to go on it because they have coverage. Now, if they don't have coverage, then they have to go on Medicare, or else there's a penalty for not going on it at the time.
What is the penalty?
There's a penalty for each. So, okay. It's generally 10% of the annual premium for Part A, for 2 years. To they look at it is what you would pay for the Part A premium, or B, it's 10% of the the monthly premium for the year. For each year you didn't do it. So it's like $18, right? $18 for as many years as you didn't take Part B when you were supposed to, gets tacked on to your Part B premium for life. Part D, it's generally 1% of the monthly premium, which is about 33 cents per month for as many months as you don't take. So veterans, if they're using the VA, they don't generally go on a Part D plan. They go on Medicare, A and B, and then the VA covers everything. But then later in life, they can't use the VA for everything and they need drug coverage. So then it's like, hey, I need drug. Okay, well, now we got to look at, well, you turn 65 here, it's been 10 years, and now you want a plan. So it's 33 cents times 120 months is what your premium, your starting premium will be on top of what the actual premium of the plan would be. So there are inexpensive Part D premiums. If somebody's going to go on straight Medicare, if you're a veteran or anybody going on straight Medicare and they're like, well, I don't take drugs, get an inexpensive plan, like a $7 a month plan, just to have it so you don't hit that penalty later when you need it.
Okay. Yeah. So if the veterans then still got to pay the 185 when they turn to buy.
Yes. So when they turn 65 and they go on Medicare, they request to go on Medicare, they go on Medicare, they still pay 185. Everybody pays 180. The only people who don't pay 185 are people with low income, under $1,200 a month. There are Medicare Advantage plans that offer a Part B giveback, and that's based around veterans because they go on Part A and B, pay the 185, and use the VA for everything. And they're like, well, I don't. Why should I even pay the 185? So if they go on an Advantage plan, and these Advantage plans are open to everybody, they can go on an Advantage plan that has a Part B giveback. So part of the Part B or up to almost the whole Part B. There's a plan out there with a 175. So the plan will pay up to 175 back to the Social Security, so it goes back into their Social Security check, so they get that back as income. Now they're on an Advantage plan. The Advantage plan is the primary to Medicare. VA is still their primary. If they go outside of the VA, the Advantage plan is their primary, and then the Medicare is the backup. If they have TRICARE for life, then that's the secondary to Medicare. So they use, if they're going to the VA, that's the TRICARE. If they outside of the Medicare is the primary and TRICARE is the secondary. It's like having this. You can go on an Advantage. The reason you would go on an Advantage plan as a veteran is for the dental, vision, hearing, and extra benefits and the Part B give back that is available. You don't have to use the healthcare. You can just use the VA however you want and then have this. So you get two types of insurance and you can just have this, paying your Part B and getting glasses a year towards them every year, whatever you want.